Coming up, we'll be on location in Fairfax, Virginia at the dental office of Dr. Maribel Vann, discussing the latest advances in dentistry and how they can help restore your dental health and give you the smile you've always desired with one of this area's top dentists, Dr. Maribel Vann. Dr. Vann received her DDS degree from the prestigious Georgetown University School of Dentistry, and Dr. Vann is widely recognized as one of this region's leading dentists. Welcome, Dr. Vann. It's a pleasure having you on our program. It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. We have some patients we're going to be meeting a bit later, but I wanted to begin, if I may, Dr. Vann, by having you please tell us about some of the advances that have taken place in recent years in dentistry and how they're helping patients.
Yes, absolutely. We have the microscope, electron microscope now that could detect the type of bacteria that's in the patient's mouth. I take a plaque sample from a patient's mouth and put it on a slide and view it on the electron microscope. Because this bacteria are linked to cardiovascular disease, strokes, and diabetes and cancer.
So these advances are through the advances that have taken place in technology.
The advances that's taken place is through the advances in technology.
Yes, the digital x-rays, the zirconia material and the porcelain crowns that is stronger and lasts longer.
And digital x-rays, the x-ray machines have come a long way. We're digital now, which you can diagnose better because you can make the contrast, from the computer, and also the digital x-rays can diagnose what we call incipient cavities when they're just starting, compared to the film radiology that is not that accurate now that we have digital technology. And another one in advances in technology is the ALF treatment, which treats permanently corrects jaw misalignment that causes TMJ disorder, dizziness, vertigo, back pain, neck pain, teeth grinding. So it corrects the problem permanently, because the root of the problem of all of these symptoms is a jaw misalignment.
Interesting.
And even on the cosmetic side of dentistry, we have a material called zirconia, which is stronger than metal. And we do crowns now with zirconia, and in terms of strength and durability, they're very superior, and also in terms of aesthetics. They're much stronger than the old porcelain fused to metal crowns.
So a lot of people can benefit from these. Makes it easier for people, better in diagnostics, better in treatment, more efficiently done in a more timely manner with better results. It's a great combination, Dr. Vann.
Yes, that's correct. And also with this DNA, the saliva DNA testing, patients don't have to go through blood work. And it's non-invasive. A lot of patients don't like needles. Yeah.
Big benefits indeed.
Yes, that's right, because they just have to rinse with a saline solution for 30 seconds and then spit it in a little test tube, and I send it to a lab. And
you are a big proponent of how our overall health is affected by our dental health and vice versa, how the two are connected. A lot of people don't realize just how those two go hand in hand in many cases. Can you please tell us more about that?
Yes, the oral systemic connection, that's what I call it. It's now with the advancement in dental technology, we're able to detect chronic diseases before the blood work detects it, like inflammation, which causes bleeding gums. That's a sign of either pre-diabetes or diabetes, if the patient has not been diagnosed with diabetes yet. And also some forms of cancer, some of the symptoms, with bleeding gums it's one of the symptoms also, that there is something. It doesn't specifically say that you have cancer, but it tells me that there is something wrong going on with the patient's body, not just, their mouth.
Yes. And that is why it's very important to visit a dentist on a regular basis.
Yes, that's right. And also, as I mentioned earlier, the bacteria in the mouth is linked to heart disease and strokes and diabetes and cancer.
What are some of the more common dental problems, Dr. Vann, that you see in your patients?
The most common dental problem I see with my patients is bleeding gums and plaque control. For some reason, it's still, even if patients come regularly for their cleanings, they still have bleeding gums, and that's because there's inflammation going elsewhere in their bodies that they don't know about.
What are some of the results that we can expect?
Well, they're seeing what's going on in their mouth, specifically in terms of the bacteria. What type of bacteria do they have that makes them high risk for heart disease, strokes, and diabetes? So now I'm able to show them that this is what's going on in your mouth.
What else do you offer that you can help people with beyond what we just touched on?
Yes, I also do veneers, for cosmetic purposes, and also for restoring the function in terms of when they have ground their teeth down. So I have to build up their bite. And, then I do the porcelain veneers and also zirconia crowns on the back teeth to build up their bite and also restore their teeth to proper function.
So they're getting much longer lasting results now through these advancements in technology that benefit the patients.
They look very natural and they last longer.
And again, how often do you recommend patients to visit the dentist?
At least twice a year, but there are some patients, after I have done their saliva DNA testing and find out, if they're genetically predisposed to inflammation, they have to come every 3 months.
We're literally out of time, Dr. Vann, but I wanted to ask you, before I let you go, you and your practice have certainly established a reputation for excellence here in the Northern Virginia region, not only in dental care, but in patient care. You're widely recognized as one of this region's top dentists. I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
What separates me apart from other dental practices is my practice is centered on the oral systemic connection. The link of the mouth to heart disease, diabetes, and strokes. And also the type of TMJ treatment that I do because it corrects the problem permanently and not just the symptoms. My philosophy is the mouth is the window to our overall health. As good health starts in the mouth, I help my patients make good decisions and know the current level of health in their mouth.
Doing some great work for the community, Dr. Vann. On that note, we'd like to thank you again for joining us, being a guest on our program. It was our pleasure having you on. Welcome, Joan. It's a pleasure having you on our program.
Why, thank you for having me.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Joan, by having you please tell us what initially brought you to Dr. Vann.
It was a long time ago, like back in '84, '85, when I first started with her. And I had met her. We had actually worked in the same practice but not at the same time. And I had a crown that had come off. And I came to see her, and she re-cemented it. And then I became her patient full-time for everything.
Oh, so you've been a patient of hers for many, many years.
She is the best. The quality of care is amazing. Her expertise, her continuing education, and she cares. She cares. I sent a friend here who was terrified of dentists, and it became one of her favorite things to do to come here. And she had not had dental care for years.
And what are some of the treatments that you've had done over that time?
Oh, let's see. Of course, regular checkups and cleaning and crowns, onlays. And at one point, I had to have 3 onlays, I think. I think it was in a month's time because I was clenching my teeth and cracking them. And that was when I started the ALF treatment, which just changed a lot of things for me.
We're happy to hear that.
Oh, it's incredible.
And how would you describe your experience with not only Dr. Vance, but her whole staff here?
Oh, the staff has always been congenial and so helpful. And if I need to speak with Dr. Vann, she gets the message right away and always calls me back.
And before I let you go, I take it you'd highly recommend Dr. Vann to others?
I would highly recommend Dr. Vann.
Well, on that note, we'd like to thank you, Joan, for joining us, sharing some of your experiences, and being a guest on our program.
Thank you for having me.
Welcome, Jessica. It's a pleasure having you on as well.
It's nice to be here.
I wanted to ask you when you first came to Dr. Vann as a patient.
My mom actually worked for her, so my mom's been bringing me here since I was 2, and she's been taking care of my teeth for a while.
And what are some of the treatments you've had done, Jessica?
She actually discovered that 2 of my baby teeth who couldn't come out found out that I had a cyst in my mouth that no other dentist told me about. So she got me all prepared for my surgery that I had on them, and she's been taking me care of them.
Would you recommend Dr. Vann to others?
I highly recommend Dr. Vann.
Well, that says it all. On that note, we'd like to thank you, Jessica, for joining us and being a guest as well. Welcome.
Hi there.
Can you please tell us about what dental problem or problems you were experiencing that brought you to Dr. Vann?
Actually, I knew her receptionist and I worked in the building. My previous dentist had retired and changed his practice over to another dentist. And I wasn't completely satisfied, so I came to Dr. Vann. And I hadn't had any major issues up until that point, basic things, but I had some amalgam fillings that I was not keen on keeping. And she replaced those with porcelains for me, basically routine visits every 6 months. And I was grinding my teeth at night, so that was beginning to crack some of my teeth. So I did go through the ALF procedures, and I didn't know that was related to some like hip issues I was having and neck tightness, and that resolved those issues as well.
How do you feel about the results?
So I've so far been very, very pleased with the results I've had with the porcelains and the ALF, and definitely would recommend Dr. Vann. I have to all my other colleagues, but I'm very pleased with the care I've been given over the years.
And on that note, we'd like to thank you as well for joining us, being a guest on our program. We appreciate it.